That begs the question then, when should somebody reach out to a medical professional for knee pain?
Sure. There's a few things that I would look for. One is your knee pain changing your movement? So certainly if you are limping in any way, that's a big one. But even if it changes your movement in terms of like getting out of a chair, it's like you kind of lean to one side so you avoid that one knee, or you use your hands an extra amount, or you'd really like to take the yoga class, but getting down onto the floor just doesn't feel like a great idea for your knees. Those are all like that. Your life is starting to get limited and your health will be affected as a result. So that's one piece. Another thing I look for is increased medication use or a prolonged amount of medication use. So it's common to go see the doctor and say, well, you might try some NSAIDs or some anti-inflammatory medication. So NSAID stands for non-steroidal anti-inflammatory drugs, and some of them are just over the counter. So it feels like that's pretty benign. An ibuprofen or an Advil or naproxen or Aleve is the brand name, and all of those you can get without a prescription. But the research really shows that the longer you take them, the more likely, if you don't have arthritis, that you'll get it, or that will accelerate your arthritis, the progression of your arthritis. So there was a study done, and there were 635 people in the study. They looked at all of these active individuals, their knee x-rays, and looked at them over 6.5 years. And they compared the people who took NSAIDs for less than 30 days and those that took NSAIDs for 180 days or longer. Those that took them for that basically 6 months or more, they had 3.2 times more arthritis, the worsening arthritis. So it's very, very significant. I think if you can take NSAIDs and for a short period of time, there can be a role for them, but it's not a sustainable solution, and it can be problematic down the line.
Yeah, it sounds to me like that could set you up for a pretty vicious cycle, right? You're in pain, so you take the NSAIDs, and of course, over time, that's actually exacerbating the pain, right? It's worsening this arthritic condition and causing you potentially to continue or take more. So yeah, there's something that we can look out for right away. I had not heard that before. That's quite alarming. Like you said, these things are sold over the counter and they're marketed to us, and it seems rather benign, because when you said meds, I was thinking in my mind painkillers, but more on the heavier pharmaceutical prescription side and not so much the NSAID. So yeah, interesting information there.